I'm now going to be talking about side effects of commonly used medications in children, especially also over-the-counter medications. Now, as you know, children get a wide variety of ailments and illnesses in their first few years of life, and it is parental nature to want to fix our children as soon as possible so that they get the quickest relief possible. But be careful, because children are particularly vulnerable to side effects of certain medications in view of their small size and also their immature little brains. Several ingredients of over-the-counter remedies actually have been associated with serious and sometimes even lethal side effects. In addition, most over-the-counter remedies for coughs and colds, for example, have actually not been found to be of particular benefit. First of all, let's talk about medications with a decongestant action. So in a lot of cold and flu treatment, they'll say decongestant clears the nose, clears the head cold. And these often contain ingredients such as phenylephrine and phenylpropylamine. These are common components. However, they are associated with pretty severe side effects. They can increase the heart rate, they can increase the blood pressure, and they have even been shown to cause heart arrhythmias and even neurological problems in children. So in several countries, such as the USA and the UK, medications containing decongestants are now not allowed in children under the age of 6 years. Even decongestant nose drops with ingredients such as pseudoephedrine should be used only for short periods of time, because prolonged use can lead to a rebound swelling of the nose. So nasal decongestants used for 3 to 5 days at a time and not more long term. Rather stick to simple saline nose drops and sprays if possible for longer term use. What about antihistamines? Antihistamines tend to be thrown at children for almost everything. Certainly, children are given antihistamines for colds, and actually they're totally ineffective for the common cold because it is not a histamine-driven pathology. So some of the old-fashioned antihistamines, such as chlorpheniramine and hydroxyzine and diphenhydramine, can cause sedation. They can even cause depressed breathing if taken at high doses. And in some children, interestingly, they have the opposite effect of causing overexcitement or wiredness or even hallucinations and sleep disturbance. So similarly to decongestants, most sedating old-fashioned antihistamines are no longer recommended for children under the age of 6 years. Rather use the newer generation non-sedating, cleaner antihistamine drugs when they are indicated. Cough mixtures. Well, how many cough mixtures do you see when you go into the average pharmacy? And cough mixtures are generally not very effective. In fact, home remedies in slightly older children, such as honey and hot water, are probably just as good and even safer. Cough suppressants, such as codeine and dextromethorphan, can cause respiratory suppression and depression and drowsiness, or even the opposite effect of a feeling of euphoria, so they can be abused as recreational drugs. Moving on now to prescription treatments. So cortisone-based treatments taken by mouth, so oral cortisones or prednisone or prednisolone, are often justified for more severe cases of croup or asthma or bronchitis. However, they should not be used for more minor conditions and common colds for which they are frequently and inappropriately prescribed. It is well known that prolonged use of oral cortisone can cause side effects such as weight gain, diabetes, blood pressure problems, cataracts, stunted growth, and even a greater predisposition to having fractures after 1 or 2 courses of steroids. Short term, as most parents who have had a child on steroids will be able to tell you, they are associated with behavioral side effects, sometimes even aggressive behavior and sleep disturbances. So a child really needs to earn their cortisone treatment and be sick enough to justify their use. Antibiotics are a topic of much discussion, and a lot of parents wanting a quick fix for their child almost have an expectation that an antibiotic will be prescribed. However, most cold-like illnesses are caused by viruses, and viruses do not respond to antibiotics. Antibiotics can be associated with side effects such as allergic reactions, diarrhea, thrush, nappy rashes, and overuse on a population basis can lead to resistance. In other words, it can render antibiotics ineffective, which is a problem for when they are really needed for bacterial infections. Of course, if medications are used responsibly and at the correct doses, most of them are absolutely safe. However, we should be wary of over-medicating the child with minor illnesses such as a common cold. In such cases, keeping the child comfortable with saline nose drops, a bit of paracetamol, lots of hugs and cuddles, and frequent small feeds is usually all that is needed for the few days that the cold lasts.